This is Speak Your Mind on Gold FM and also FBC TV. Welcome to the show. Well, the National Meningococcal Vaccination Program began on the 14th of May. Today, we will find out about the importance of vaccination, what should you do if you did not get the vaccination on time, and what we can continue to do as parents to help stop the spread of meningococcal to our children if they are waiting to be vaccinated. Now, to provide us with an update on how the mass immunization program is rolling out in most parts of the country, and also to get your questions answered, any questions that you may have, okay, we have Sister Lityana Volavola of the Ministry of Health's National Immunization Program. She is also the program manager. And Sister Volavola, thank you so much for being on the show, and welcome as well to Speak Your Mind.
Thanks, Gwen. It's wonderful to have this opportunity to be able to share more on this meningococcal vaccination program that, as you've said, started on the 14th of May.
And just on the vaccination program, Sister Volavola, we're rolling out this. It's a mass vaccination program.
Yes,
we're trying to control the outbreak of meningococcal, and of course, the outbreak was declared on the 20th of March of this year. Can you tell us, is MANSI still circulating, though? What's the current disease status?
Thanks, Gwen. Just to talk about the outbreak. When we say the word outbreak, it's not a place where the attitude is like routinely. When it comes to outbreaks, our efforts are doubled up because we'd like to halt the transmission of that particular bacteria or virus that's causing the disease that's out there. And for us in particular, or looking at meningococcal, it's caused by this particular bacteria that's called Neisseria meningitidis. So in looking at the status so far, while sitting in our task force meeting, we've continued to have suspected cases. But those suspected cases whose specimens of bloods have been taken, they've come out negative. So far, the negative is really looking at when we start the outbreak response like vaccination. It's a good sign for us, which means once we started our vaccination, it has managed to control MANSI disease spread. So that's what we can say. And having said that, the number of cases was still coming up from under ones, and also in between the age group of 1 to 19, we were having some 14-year-olds. But like I said earlier on, the number of cases has lessened. So that's a good sign for us.
And it's under control now with the vaccination program rolling out.
Yes, we can say it is under control.
Sister Volavola, how enormous is the meningococcal burden for the Ministry of Health?
Thanks, Gwen. Burden. Just saying 1 to 19 years, that's a big cohort. It's like double 10 cohorts of children. And the number that we had strategized to reach of the 1 to 19 in Fiji was looking at 320,000 children. And these children all over Fiji in the different geographical areas, in the different divisions. And 320, where do we find them? How are we able to better reach them in order for us to vaccinate all of them? How do we reach not just vaccination, that's them to be vaccinated, but how do we reach the parents first to understand our fight against meningococcal disease in order for them to give the okay for us to vaccinate their children? So it has been big, and having said 320,000 children in Fiji, 10 million is the cost of the vaccine itself, not counting our receipt of vaccines, the storage of vaccines, the distribution, how much we have to distribute. For example, when we received for Western Division, or even Central, because we started Central Division first and Ra subdivision in the Western Division, one health center, given their big target population, how they had microplanned, we could visit that health center 3 times in a week, 4 times in a week. And then again, parents have consented. Nurses were moving out with their big cold boxes, sending vaccines out, and us in turn just replenishing from supply area or supply department to that. And so it has been big. That's looking at logistics. They're moving around, and when we say moving around, we've got vehicles, but some places where the vehicles were late, we had to hire some vehicles, and then, payments and all these other things. So that's how big it has been for us. And then again, having to tell parents where they could access. If I have to break down the 320,000 children, we are looking at three categories. The 1 to 4 children, 1 year to 4 years, and then we're looking at the 5 to 12 years, whether they're in school or out of school, whether they're in the kindergartens, that's under the school. And then we've got the high schools, and then we've got the out of schools, which are tertiary. So looking at where we could reach them, or them reaching us, like accessing our facilities just to get vaccinated. So that's how big it has been for us, and it's still ongoing, given the different areas and geographical areas and the number they need to vaccinate according to their itineraries that we had set down and microplanned before any rollout. Yeah.
Sister Volavola, okay, so the vaccine stand at 10 million Fijian dollars, the cost of the vaccine.
Yes.
You spoke about logistics. How much is that costing the Ministry of Health? Would you be able to give us a figure? An estimated figure?
An estimated figure would be sitting at more than 200,000 for now. And like now, we're just micro-planning to leave Suva on Sunday to reach the Eastern Maritime. And the budget that I've just budgeted for before I came was looking at 44,000. That's just using the boat. There's a boat, a medical boat that we're using. So given the areas of Matiki, Nairai, Moala, and other parts of Laos, that's 44,000 just for them alone. Not counting if we have to send vaccines to Rotuma, which is going by the boat tonight, and Loma Loma by next week, and Loma Loma South. Those are all maritime. So yeah, it's looking at, well, I could say almost 500,000 on the ground. That's counting also the nurses' subsistence and all the claims that's coming in.
On Speak Your Mind, we're talking to Sister Litiana Volavola, the Ministry of Health's National Immunization Program Manager. And also, if you have any questions on the Mansi vaccination program, you can call and speak directly to Sister Volavola, 3220906, or you can also call 3220907. This is Speak Your Mind on Gold FM and also FBC, and the discussion this morning is focused on the National Meningococcal Vaccination Program that began on the 14th of May. And of course, having the discussion with us this morning is Sister Litiana Volavola, the Ministry of Health's National Immunization Program Manager. Sister Volavola, just to continue where we left off, as of April 22nd, there were 4 confirmed deaths. Have there been reports of any more deaths or suspected cases? What are the new statistics?
Thanks, Gwen. In terms of the confirmed deaths, we haven't had any other deaths so far. But just to correct that, we've had 5. So it has set at 5. We haven't had any deaths so far due to meningococcal. But yes, we've had suspected cases, around about 25 from the last week. Just to talk about suspected cases, they've had their specimens tested and they've all come out negative. So right now the cases have increased a little bit from 87 to 92, but having said that, they were all suspected cases, but we still wanted to rule out. So we had them tested and they've all come out negative. Again, to us, from the time we had started this meningococcal vaccination campaign, we can say that the vaccination has helped reduce this disease burden for us.
And just on the vaccination, could you give us some key information? It protects against type C meningococcal, which is common in Fiji. What is the vaccine called? And also, if you can just help us to understand how it works in the body to protect, just say when an infected person is sharing a grog bowl with with a vaccinated person? You know, how does it protect one?
Okay. Thanks, Gwen. Just to talk about the key information about the vaccine, just to share a little bit with you, it has been very interesting to combat this meningococcal outbreak in Fiji. We've had 4 different types of vaccines to combat meningococcal. One is called the Menactra. It has 4 different types of the causative agents, the bacteria that causes meningococcal. It's covered in that one vaccine. It's called Menactra, and that was the one that we had used last year for one of the major schools outbreaks, and also early this year that we had another outbreak from one of the high schools in Ra subdivision, which is one of another boarding school for us. And then for the first phase that we had received of the 124,830, it was a different vaccine altogether, but all targeting MENC. That's this particular type that's causing meningococcal disease in Fiji. And the name of the vaccine was NASVAC. And the current one that we are using now for the 200,000 extra doses that we have come in to target the 320,000 children is called the MENINGOCOCCAL vaccine. And to talk about the vaccine, one, you have to look at the presentation of the vaccine too, how it comes. Normally the vaccine routinely come in vials, but these ones to combat this outbreak, they come in pre-filled syringes. And we'll talk about that later in the cold chain. But the four different types, and then we always talk about different type of vaccine that's used also by the military forces in protecting them against meningococcal. It's called Nimendrix. But for us in Fiji, we've had Menactra, we've had NASVAC, and the current one we are using now is called the MENINGOCOCCAL vaccine, and it's called a conjugate vaccine. And as these are different, there's conjugate, there's polysaccharides. But for us, the conjugate vaccine is very good because it's a long protection in a very short time that we're vaccinating, because we're given time frames in this outbreak response. It's not for the whole year or anything. It's just short. And we'd like to maximize and reach the whole 320 wherever they are in Fiji. So the conjugate vaccine is a good vaccine for us, given it's very effective also to the children, because our target is 1, even though the cases are coming in below 1. So vaccinating the 1 protects also the under 1s, and that's what we've seen. We've had specimens, like I said earlier on, suspected cases, but tested, and it's found negative. So, and then that's the conjugate vaccine, which is very good for the children and also the older children, because we're looking at 1 to 19 and looking at how vaccines work. Responses different. We are all individuals. The vaccine, when we get vaccinated, the responses are different in each individual person, and that will show in the side effects too. But usually 1 dose of vaccination, it takes about 10 days or 2 weeks for the body to respond well to it in order for them to be protected, to develop that immunity that we want in them against that particular disease. So it's the same way. It takes about 5 to 7 days. But we talk about in this meningococcal, looking at how deadly it is, we'd like to talk about a month, how it causes that immunity response in the body. And the protection rate for this meningococcal vaccine is 3 to 5 years. So 3 to 5 years in these outbreak responses doesn't stop us. That's just vaccination, because drugs or the drugs that we have been having is not to that response where we want to halt the transmission of that particular bacteria. So vaccination is the frontline vaccine, choice of administration or choice of outbreak response for us. So far, 3 to 5 years. But then again, there are other measures to protect the body, not just vaccination alone. And those are the things like not sharing bowls of cover, whatever it is, from an infected person. Yeah? Then we don't know who's a healthy carrier. But those are some of the ways. But vaccination in the body, that's the first line of protection. And this is what we're trying to do, just to protect the 1 to 19 against meningococcal bacteria. And having talked about the vaccine again, it's safe. We've continued to tell the nurses, to share it with everybody. The vaccine is safe. And although every vaccination, you'll always have side effects, but we've continued to share it with parents that there are some side effects with this vaccine, like itchiness, some rashes, slight vomiting, nausea, feeling fainting, even to some places where there's fainting. We've had cases where there's been reported that we categorize them medically or technically for the program after effects following immunization. So there's been some fainting, but when we went back and the parents said to the two reported that those are the things that happen to our children every time they get vaccinated for even routine. So it's safe. We have side effects, but they're normal to this. Unless if there was any shortness of breath, we advise the parents to bring them quickly to the health center or nursing station. Things like other things like irritability, sleeplessness, or other things. Yeah, we've had parents on the last talkback show in Fiji, and they said where there is shivering. So I'm glad that they brought their children to the health center. Yes, but otherwise talk about that. And again, just talking about the vaccine, it's safe, it's effective, it's protecting children against this meningococcal disease. Thanks, Gwen.
Speaking to us, Sister Lityana Volavola, the Ministry of Health's National Immunization Program Manager. Also stay with us, because coming up on the show, the Ministry of Health's target was to vaccinate 325,000 Fijian children. How many children have been vaccinated so far? How many remain unvaccinated? That's after the break. This is Speak Your Mind on Gold FM and also FBC TV. Our discussion this morning focuses on the National Meningococcal Vaccination Program, which began on the 14th of May and will roll out until September the 30th. And of course, we're having the discussion with us is Sister Lityana Volavola, the Ministry of Health's National Immunization Program Manager. Now, Sister Volavola, the Ministry of Health's target is to vaccinate 325,000 Fijian children. We had a talk earlier and you were telling me that 23,938 children remain unvaccinated. How are you ensuring that you're meeting your vaccination target?
Thanks, Gwen. Just to answer your question, yes, we are looking at 320,000 children in Fiji from the age group of 1 to 19. Let me just break that down and talk about the phases. So phase 1, we had received 124,830 doses. Of that, we've managed to vaccinate 124,920, and that's looking at Central Division plus also the RA subdivision under the Western Division. Our total for that first phase is 148,858. So unlike what you asked, 23,000 is still yet to be vaccinated, 23,938. And phase 2, we had received 200,000 doses. Of the 200,000 doses, that's the one we have commenced with vaccination in the Western Division and also the Northern Division. And still yet to vaccinate the Eastern Division, whom we will start when school starts for term 3, and that is next week. But so far for the 200,000, we've managed to vaccinate 93,128 children, of which our 197,945 is our target altogether. So in the 200,000, we still yet to vaccinate 104,817. And I keep saying every time we talk about numbers, those are children. The children, the numbers are children. So 23,000 children, 938 are still children that we are yet to vaccinate in the Central Division plus RA. We're still vaccinating them. Parents are coming in one by one. And interestingly, for the 23,000, this particular age group is the one that's lagging off behind in terms of our coverage or reaching or them accessing our facilities. It's the 1 to 4. And it's the special target population, because if you look at the 1 to 4, it's most of the cases we've had are under 1s. So yeah, that's what we're looking at, so that we're encouraging at the same time for parents to understand how important and access the facilities. I know of experience, we're still having some places now where they've gone to the health centers, but the health centers have completed the number of doses. So we're still distributing vaccines to the nearest health center. So we're asking them, if it's not there, then just please give us a call so they can get the children vaccinated. These are numbers. The vaccination is still ongoing, and the data is still yet to come in. So we're receiving some changes, and we might have some more changes in the next update after the end of this week. We're probably looking at Monday when the data's all come in weekly. But when we had microplan for the campaign, we wanted the data to come in every day. But for some places, every day wasn't feasible. So we've made some allowances. If by the week they could send in their coverage, 1 to 4, 5 to 12, and 13 to 19. So 104,817 yet to vaccinate Eastern Division. And that's looking at Yasawa. For the Yasawas, I spoke to the operational manager. They still have to visit their Lombi. And for Central, we're still vaccinating. They still have to come. And also for looking at other areas, like in the Western Division, there's still some parents yet to come in. They've gone to hard-to-reach areas. Now they're staying around to where there's most of the population in their more medical area that they're really responsible for, apart from the hard-to-reach areas. And then the Eastern, that's Rotuma, Lakemba, Levuka, Olomaiviti, and looking at Kandavo also. But these are the main islands. Otherwise, there's a special boat, like I had mentioned earlier, which is going from island to island. So what we'll do is get off the boat, do a little bit of awareness again, vaccinate the children, get the data on, and get back to the boat, and then move to the next island. So that's how it's going for us. But yes, 320,000 is our target, and we'd like to reach all of them. However, that means we will microplan. If some areas we can tweak, we're flexible, depending on, we've got teams on the ground that given their tasks, the role sits covered under our standard operating procedure. And then again, we make allowances if one of the team members is sick or the weather or anything, then that's how we re-strategize. But it's ongoing for that.
But are you meeting your target deadline? You want this, the meningococcal vaccination campaign is only until September 30th, which is next month. It's not too far off, looking that it's close to the end of August. Are you meeting your target successfully, the timeline?
Yes, I can say we are meeting our target deadlines. Looking at the data, the operational managers who are sending the data, I can say that we are meeting. For the RAS subdivision, they've managed to hit 95%. For us, our vaccination target is at least 95% or more. So if we have 95% or more in that particular area, then we know that it's called herd immunity, where even those who are not vaccinated get to be covered under that. There's a whole lot of babies that are vaccinated, and that causes a protection over those who have not been vaccinated. So that's that. Tavo is sitting at 92%. Zingatoka has managed to read right up to 97%. So yes, I can say that they are reaching their target, and that's reading and interpreting from the data that they have been sending in. Mm-hmm. And Eastern, that shouldn't be any problem for us. But one of the things we have found out on the job, even though we come up with targets, these are the numbers that the nurses have given in, registers and all the other things. But sometimes on the job, and you find out that some of the numbers weren't correct. So those are some of the things we just continue to learn on the job. But to answer your question, I say that we are on target.
Okay. Just very quickly, Sister Volvol, before we go on a break, 23,938 children remain to be vaccinated for the Central Division. That's quite a significant number. Our doses, do we have sufficient supply?
Yes, we have sufficient supply for them, very much sufficient supply. The only thing is for parents to understand and bring their children. It's not too late. We're still open for them. They can give us a call. Our numbers are on the website, or just come to the nearest health center and ask for that, and we can just vaccinate their children. Even to some places, if they request, especially for working parents, we can open on Saturdays. If they just call and let us know. Yeah.
On Speak Your Mind, well, we're having a discussion this morning with Sister Lityana Volvola, the Ministry of Health's National Immunization Program Manager, and we're discussing the National Meningococcal Vaccination Program, which began on the 14th of May. This is Speak Your Mind on Gold FM and FBC TV, and just continuing our discussion, Sister Vola Vola. Now, something you had mentioned, but it's so important that I just need you to reiterate, this. For those that are vaccinated, how long are they protected for? Is it for a number of years or their lifetime? How long does a vaccination last?
Thanks, Gwen. Yeah, keep talking about how effective it is. Like I said earlier on, one dose for today takes about 10 days for them to develop immunity, and the protection rate of the vaccine is 3 to 5 years. So 3 to 5 years, that's protection through vaccination, but that doesn't stop the community from other preventative measures like, good hand washing, coughing or sneezing through a handkerchief or the inner part of their shirt, or one of the things that the way this disease spreads is through the saliva of an infected person, and we want to look at that basic area of sharing. We'd like to discourage sharing of spoons, sharing of cups and plates, and looking at a wider range of sharing yangon cups, bowls, or however they use. It's because we do not know whoever the person is. And, interestingly for us, we've had a carried survey. I won't delve too much into it, but it was interesting to see that most of those who participated in those were healthy carriers of this particular Neisseria meningitis. So, and they know very well. It's the only way for us to really know well is to practice that, not knowing how to. But then again, protective measures, one through vaccination and the other means to just take it on from there. And that's like promoting health practices, good health practices, apart from vaccination itself.
Sister Vola Vola, those at highest risk are babies and teenagers.
Yes.
Let's just look at babies. A parent with the baby may worry, and the babies are already taking a course of vaccines.
Yes.
Against just to mention two, like tetanus and polio. And now the Man-C vaccine. A parent may worry. This is too much vaccines. It may be an overload here.
Well, thanks, Gwen. Yeah, it's logical questions. Parents do ask, but for us healthcare workers, it's our duty to share with them what vaccines the children are receiving, apart from the routine ones like tetanus, yes, and polio. So these are some of the things that we routinely share with the parents before we administer the vaccines. And if they are due together with the meningococcal, those are some of the questions that some of the thoughts that worry the parents, that they might think we are overloading the system. Really, it's not overloading them. For us, we're giving like 4 injections against diseases that are out here in Fiji. Apart from the polio drops, we've got polio injection also that's given at 14 weeks. We've got the pneumococcal one against pneumonia in Fiji. We've got the pentavalent vaccine, which is also against one of the meningitis diseases, covering of the brain, that causes sudden onset of fever, prolonged fever, sometimes crying, and even stiff neck. So those are some of the things. It's all covered, but we're not overloading the children. But right now, we see it fit. If they are into that age group and the meningococcal outbreak response vaccination is now on, we will vaccinate them also at that. But then again, continue to talk about each particular disease, each particular vaccine, what are the benefits and the values against the risks and the cost, and then we vaccinate the children from the parents' understanding, but no overloading.
Sister Vola Vola, you had also mentioned earlier that the vaccine is safe.
Yes.
It's safe, but it does have side effects, and what are the common side effects for babies, and how can parents treat this?
Okay. Thanks, Gwen. Yes, every vaccine is safe, because they've been tested clinically, they've been trialed, and the manufacturers have done trials for them, and it has come out. So for us, when we say safe, it's from WHO. And one of the criteria is it's called pre-qualified. So WHO gives us the okay that we can use that particular vaccine. So again, every vaccine does have side effects, but side effects, benefits and values always outweigh the side effects. But side effects, yes, we always try and address it, never want to push it under the rug. It's one of the things that the parents look to and they sort of hesitate in allowing their children to be vaccinated. But for this meningococcal, like what I've shared earlier on, there's rashes, not rashes, just itchiness. Some places where we've had rashes, like some schools, have mentioned or reported, the nurses have reported also fainting, nausea, vomiting to some places, not much, but fainting, yes. And like I shared earlier on, that the parents said, oh, that was normal every time they get vaccinated in school. Itchiness and irritability, that's sleeplessness. And usually side effects for us when we administer vaccines, we sit them down for at least 20 minutes and monitor if there was any onset all of a sudden in that within 20 minutes. So, and also side effects could happen when they reach home after 24 hours, after 48 hours, after 3 days. So these are the things we'll continue to tell the children if there's anything like this, or the parents, that they can always bring their children or call us if they have our phone numbers, or bring their children to the nearest health center, unless if it was serious like rashes and it's causing shortness of breath, and those are the ones that we categorize as serious. But not saying that the other minor ones, which are normal, is not serious. We still need to tell them that these are the side effects, so that parents, it doesn't catch them off guard, and they know that apart from its safety, that these are the normal things that happen. But then again, for most of the areas whom we've vaccination has been conducted, there hasn't been any reported ones. But those who have reported, we've filed them. We've filled forms, and it's filed at national level.
Yes. And they have been treated?
They have been treated. To those ones like rashes and itchiness, they have been treated in the hospitals. Yeah. To the case last month, parents ran up, and so the hospital treated them for that particular area, and there hasn't been anything serious from those.
The babies recovered?
Yes, they have recovered, especially school children. Not babies. Babies have really been very well receptive to the vaccine.
My final question on babies. Which babies should not have the vaccine right away? I'm talking about here if a baby has a high fever. What is recommended for parents?
Okay, thanks. For babies having high fever, for that we could say that that's a true contra. So we will wait for fever. If the parents say that they have high fever, they brought the babies to the health center, we'll take our own temperature reading, and then we'll measure. If it's more than the reading of 37.8, then we will not vaccinate. We will hold and keep that dose for that particular child until they come back to the next clinic, which is a communication between the parent and the healthcare worker, that when the fever subsides, then they can always come back for the next checkup in between this time until September, and they can get their child vaccinated. But that's the one that we will not vaccinate. Otherwise, if baby's on antibiotics, we still administer this meningococcal, because really, like what you said earlier on, you had asked me about overloading. It's just boosting the immunity response against this particular new but deadly disease.
Sister Volavolo, the other high-risk group, preteens and teenagers. And when you look at the rundown of the cases, 94.5% are 19-year-olds.
Yes.
But say they're not in school, they're part of the high-risk group. The responsibility for 19-year-olds is on them to show up to be vaccinated. What has the response been like from this group?
Okay, just to go back to how we had planned, looking at 13 to 19, 18 and 19 are the age groups where most of them are not in school, in tertiary areas. So we've microplanned to reach them, also given dates by the nurses or the healthcare workers. These are the ones who can consent for themselves if they understand how important they are. And the reason why, I will just go back a little bit, why 1 to 19 is because the carriage is very high in this age group. That's the reason why they were chosen, because we've always got calls, why only 1 to 19 and all these things. Why one and not the under ones, because under ones are the ones that have been presenting with cases, and we've had some deaths too. But if we protect the one with over 95% coverage, that it protects the under ones, like we've seen, the suspected cases have gone down. But 18 to 19, yes. And so these are the areas where they need to understand that the high carriage is amongst this from research, which is our intervention is evidence-based. And just to talk about reaching this 18 to 19, we've gone to tertiary institutions to vaccinate them. And interestingly, on the ground, the nurses have gone as far as, for example, Mba. They're telling me the story last week that they had gone to cane fields just to reach them. And yeah, it was really good to see cane fields or working in the supermarkets and all these other areas, like working with machines. These are where these vulnerable age groups are, and they have managed to vaccinate them. So, but then that didn't stop them. To some places they said they heard about it, some places said they heard, but they were scared. So the nurses had to sit them down, talk them through the disease again, then make them understand why they were important to be vaccinated, and vaccinated them. And almost all of them, I haven't received any response where they refused. Yeah.
Coming up on the show, we'll go for a short break, and when we come back, we're going to discuss what you should do if you did not get the vaccination on time. And speaking to us is Sister Lityana Volvola, the Ministry of Health's National Immunization Program Manager. Welcome back to the show. This is Speak Your Mind on Gold FM and FBC TV. And Sister Volvo, just continuing our discussion, what if someone misses a vaccination program? Say they're no longer in school, or someone in primary was absent during vaccination. How can they ensure that they're still vaccinated?
Thanks, Gwen. For those students who are in school, who were absent on the days when the nurses or healthcare workers visited their schools, most of the nurses are doing mop-up, so they're going back to the schools. If they still cannot vaccinate them, then the messages are relayed to the school health teacher or the management that they can always come and get the children vaccinated in the nearest health center. So that's the messages of the communication that's happening on the ground. It also applies to the older children, to right across 1 to 19. Especially 18 to 19. If they miss like tertiary institutions, they can always come. The message is for them to come to the nearest health center and get themselves vaccinated. And this applies to the parents too. If their children in the age of 1 to 4 still, they've just realized how important it is, or maybe they were busy with the work schedule, they can always bring their children to come into the nearest health center or call us, preferably where they want to go to. Yeah, because we've had things like some health centers may have run out of vaccines, so it's quite a hassle again. But if they can communicate with us earlier on in the weekend, if they want their children to be vaccinated in the weekend, then that's all right for us. But just to communicate that to us.
Now, what if a parent says, my child won't have a chance of getting, Man C because all the children in the class are immunized. What can be overlooked here?
Okay. Well, one of the things we're looking at, that every child needs to be vaccinated for themselves. That's why every parent or every child has been given a consent form and information about this particular men's immunization program that we are running. And so that's what we have done. But then again, we've had on the ground reality. We've had some parents who have flatly refused, but to some extent, most of them have, out of just discussions amongst other parents, out of the children's discussion amongst the peers, they have sort of come around again and consented for their children to be vaccinated. But for us, if there's in a setting like a class, and there's about 70, and 2 have decided by the parents not to consent and get the children vaccinated. If the 68 get to be vaccinated, for us, that's like more than 95% in that particular class. So if these children who have not been vaccinated, medically they can get protected over the 78, because they will have that canopy of covering those who have not been vaccinated. For us, we call that herd immunity. It causes immunity also to the ones that are not vaccinated. Mm-hmm. But again, we'd like all parents to understand the importance of meningococcal disease, Neisseria meningitidis, and have their children vaccinated for themselves.
And those who are waiting to be vaccinated, how can they ensure that they are, continuously protecting themselves against MenC?
Continually protected?
Yeah.
Yeah, okay. So, like I said, protection first line for now in this outbreak response is getting their children vaccinated on time, vaccinated on the age group. It has to be the right age group for us. We'll calculate, given when parents come in 1 to 4, we look at their cards, the child health record cards. So in school, we make sure that they are the right age to be vaccinated. Vaccinating them on time means in this period we vaccinate them, and that they develop the immunity response, and then not stopping there. Other measures like what I've said before, sharing, like into schools, never knowing who is a healthy carrier. And then again, saliva from an infected person, things like cups. Then again, if you notice in school, this is just an example. Sometimes they don't have cups to drink from the tap. So when they go to the tap, they put their mouth right onto the tap, and the next child comes in, not even just washing the tap, that personal hygiene really needs to be integrated for prevention methods apart from protection through a MENC vaccination.
Well, speaking to us on the show is Sister Volavola, the Ministry of Health's National Immunization Program Manager. Sister Volavola, I thank you again for your time.
Thank you.
This is Speak Your Mind, and of course, thank you for your time, and we'll join you again next Tuesday.